As men grow older, we're frequently told by doctors to get screened for prostate cancer and keep a yearly tab on our PSA or prostate specific antigen numbers for any red flags. Well, today's guest has grown wary of what he calls systemic misinformation that is being doled out to the general public regarding this life-threatening disease. In fact, after battling prostate cancer himself, he took it upon himself to share his knowledge and personal experience in hopes of helping other men who may one day wind up in the same circumstance. We're going to meet him next. Stay tuned. MJ Wolfe here, and
welcome to the Wolfe Den.
So we've got Chloe modeling your product.
Yo, MJ, what's up, man?
Hey, MJ.
You are in the Wolfe Den.
So excited to be in the Wolfe Den.
Hosted by MJ Wolfe.
Hey everyone, and welcome to the show. Today, I am pleased to introduce a man that is passionate about spreading the dark truth about prostate cancer. His sudden diagnosis and shocking process to treatment continues to drive him to untangle and share the systemic misinformation around the disease, much of which he shares in his book, Prostate Cancer, Sheep or Wolf. His name is Murray Keith Wadsworth. Murray, welcome to the show. You are officially in the Wolfe Den.
Excellent. Good to be here with you, MJ. One of my other passions is actually wolves. And in the last few years, I've been looking for wolf dens. I never thought, though, that I would be in the Wolfe Den. So this is great.
That may be a bad thing to stumble on in the wild, though. Well, Murray, before we get started, as we always do, I want to give our viewers a sneak peek at just who you are. So check out Murray in today's Guest Glimpse. Wow, Murray, it looks like you've had an adventurous life. So your interview here in the Wolfe Den couldn't have better timing, as September is Prostate Cancer Awareness Month. So tell me, why is Prostate Cancer Awareness Month so necessary?
Because the screening guidelines are poorly defined and confusing. I think if we talk to the average man, he'll know more about breast cancer screening and more about colon cancer screening than he will about prostate cancer screening. And the guidelines, actually, the written guidelines in the US put more emphasis on the harms from screening than screening itself. And the first screening step is a blood test. So it's crazy, and it's part of what I call now the misinformation. The reality is there's over 3 million men in the US alone with prostate cancer today. 34,000 deaths. Maybe some say, well, they're mostly old men, and to me, it seems like it's unimportant. Well, not to the families and the men themselves. 250,000 new cases a year. If we did more screening, we would find more. But more importantly, behind all of this, and well over half of them, 3 million men that have it, are the drugs that are used to slow this cancer down. And these drugs are actually referred to as chemical castration. And the data says if a man lives long enough, he'll get this disease, but most men won't die from it. But chemical castration is not a good way to be. And I spent a year on these drugs, and they are tough. And there's no man that says they're a great place to be. So that's why it's so important. And the other aspect is there's a shift slowly underway. I mean, this shift is right now. In just the last few weeks, I watched information come out of the University of California, San Francisco, and the Cleveland Clinic. Both are highly rated prostate cancer centers, and they're talking about smarter screening. That's their marketing tagline. My first thought is, well, if you're saying smarter, well, then what are we doing before it's smarter? But they're now talking about bringing the age down and also the guideline of what your prostate cancer number should be. They're bringing that down to men in their 40s. It should now be down below 1. It's nanograms per ml is a technical term. Well, in my 40s, when I was screening, my number was above 1. but the alarm bells wouldn't go off because that number was below 4. And that's the standard range for all men of all ages. So thanks for bringing up this topic today with us.
Okay. And how long ago, if you don't mind me asking, were you diagnosed, and how long did it take to fight everything off? And how did the experience must have been unbelievable?
I was screening regularly, and it looked like everything was good. We were debating about whether I should do another biopsy or not, because there's a lot of negativities in that. But 7 years ago is when I was diagnosed.
Okay. So as someone myself, my father passed of prostate cancer, and, I do get regularly tested. So I used to get tested the unfun way. I won't get into details, and I didn't enjoy that. And then more recently, we've been doing the PSA antigen test. As far as those two go, how effective? I mean, people used to just do it the old way. Now that PSA antigen has come out, obviously more and more people are doing that. Is that safe enough for me? You're saying it's not safe enough. If I'm above a 1, should I be getting additional tests on top of that?
I believe so. And again, the University of California, San Francisco and Cleveland Clinic have now come out publicly and said yes. So the uncomfortable test, what is widely known around the world, is that the physical exam misses almost all early stage cancer. So when your doctor tells you you're all clear, what the doctor's actually saying is, MJ, I didn't feel anything today.
And if it's small, he's not going to feel it, right?
They're not going to generally feel the early stages. Mine was first discovered by the physical exam. I was over in England where I was working and living, and the doctor there sort of laughed and he says, "You Americans," and he did the procedure for me differently. So as you know, we bend over on the table, right? There, what they did is they had me lay on the table, and then you interchange bringing a knee to your chin, and they roll you about, and they're trying to get this prostate gland to rotate a little bit so they can feel the backside of it, which is where my tumor was sitting. So in your 40s, if your PSA is above 1, you should no question, do further investigation. And again, in my 40s, my PSA was 2 and 3. But it was below the standard guideline of 4, so he said nothing to worry about. And the next step today is an MRI. We do imaging for colon cancers, we do imaging for breast cancer. Let's just go get an MRI.
That makes sense. So let me ask you, why did you find it necessary to go to Europe for diagnostic and treatment methods?
Well, I was living and working there, and it was time for me to do my annual exams. And I made a decision not to come home. So I needed to find a doctor over there. I went down and had a blood test, and my PSA was up, concerningly up. So I asked around and got referred to a good urologist. And that's the one that did the different exam. And that got my attention right away. And then he immediately said, "We need to get you right to an MRI." And I had been screening for 10 years, and I had never heard of an MRI for this. And they're like, "Well, that's routine over here. It's what we do next."
Really?
Yep.
So would you say Europe's overall process for looking into treatment and looking into whether you have it or not is a lot more advanced than the U.S.?
Their diagnostics are more advanced. They have a different drive than we have over here. What I came to learn as an employer, and I had employees on the National Health Care Service, and I also provided them with private insurance, is a lot of Europe is focused on preventative. They actually want to stop spending money because they're so restrictive in the money they spend. So if they can get it early and treat it early, they just see it as saving lots of money. So they are pushing imaging. Not only do they push imaging in the early stages of diagnosis, but once you have metastatic disease, which I experienced, they're also pushing imaging, and they're years ahead of us on that. We're catching up, but they were ahead. In terms of treatment, if you're going to have surgery here or there, I don't think it matters. If you're going to have radiation here or there, I don't think it matters.
Okay. And you mentioned radiation. So how long was the process from you being diagnosed to you being announced clear of cancer?
Well, I don't have a clear diagnosis. I won't allow that, is to be sort of blunt. Many would say I'm clear based on my PSA numbers, but I work with the very, very low numbers. And I had a prostatectomy. That's the removal of the prostate gland. It was my decision for the primary treatment. And that did not get it all based on the PSA numbers after the surgery. So then a year later, I had salvage radiation. And then you wait a few months to do the PSA testing again, and the numbers again were not low enough. So we knew cancer remained. And the question then became, what do we do now?
Okay. And how often are you checked now?
I check today, actually. I check my PSA every month, and I've been doing this for about 2 years. Many doctors would say I'm crazy, but I do it to keep things calm. And I do it to see what my trend line is. So my numbers were very low. This gets a little technical, but when I came out of my third treatment, which was salvage lymph node surgery that I had done after imaging in Europe, my numbers were less than 0.006, which is a stunning number. So, we watched it start to creep up. So now I watch it, and I'm now in the 0.3x range. Many would say, that's well below the US guidelines. The guidelines declare recurrence at 0.2, but I had lymph node cancer at 0.1. So I don't even want to think about 0.2.
Yeah.
And so I'm watching it, and I'm doing some things. I've done some imaging. In the last 6 months, the imaging was determined to be clear, but I actually have those CDs over in England now being checked for a second opinion, because so often we miss things with imaging, and particularly it's brand new in the US. So I'm going to get a second opinion.
Are there any, I know a lot of men take some of these supplements you see, what's the most famous one for prostate? I always see the same ingredient.
Pomegranate.
Yeah. If are any of those actual helpful? Do you believe they actually help either shrink the prostate or control possible keep cancer at bay?
I have not read anything that provides sufficient information. What I can share is a former friend, because I don't live over in England anymore, who was a prostate cancer specialist, a scientist. He was studying broccoli. That's one of the other things that it said, broccoli. And he said, yes, we're seeing benefits in mice using super broccoli. But he said that the amount that we have to use, no man can consume. So does it really help? I'm actually doing some supplements now going after what are referred to as cancer stem cells. So in this range where the PSA is extremely low, and in my case, because I had cancer in the lymph nodes, we knew it spread. Now it's hard to believe it's all gone. But what's happening? It's not showing up on imaging. The PSA is not rising to really high numbers. There's now thinking that these stem cells just could sit for many, many years before they get really active again. And so the question is, why is my body not taking them on or defeating them? So there are some things theoretical largely, but why not? It's harmless.
Yeah.
And so I do it. And it includes a pill that includes broccoli and other things.
Saw palmetto I heard of as well.
Saw palmetto.
Yeah.
We don't know for sure, but in my stage, I'm trying it. I'm trying to say, can I do anything to help my body get after these few remaining stem cells before they take off on me again?
That makes sense. Well, I won't ask you the next question. Our subscriber will. We're going to go over to our next subscriber question for today. Let's listen in right now.
Hi, Murray. This is Josh in the UK. I'm just curious, how young should men start getting screened for prostate cancer? Thanks for taking my question.
Hello, Josh. Great way to ask the question, how young, as opposed to how old, or should I do it at all? The data that's coming out now, the new discussions that are coming out now are in your 40s. And I think the bigger message to men is, as you approach your 40s, you should have been checking yourself for testicular cancer. It's a curable cancer, but the treatments can be pretty rough on men. And as you move into your 40s, you could start worrying a lot less or thinking a lot less about that. But you want to now start thinking about prostate cancer, and you want to get the baseline number. how low are you in your early 40s? And if you're at a 1 nanogram per ml or less, the data would strongly indicate you maybe don't have to rethink this for decades. And if your number is above 1 in your 40s, and in particular your early 40s, you should probably do a little more further investigation. It doesn't mean anything. It's not an alarm to go off, but you want to be aware. So in your early 40s, as a young man, so you can stay young.
Okay, great. And you answer, I'm sure, a lot of questions in your book, Prostate Cancer, Sheep or Wolf. Can you tell the viewers what they're going to find in that book, what kind of information you give out?
Absolutely, MJ. So the first 2 chapters are about screening. The first chapter I titled The Conundrum of Screening, and I go through government guidelines and recommendations and how crazy this is. And the second chapter is how my screening failed me. And for 10 years, there's no question it failed me. I followed standard guidelines, and my cancer was growing and spreading while we thought everything was okay, because that physical exam missed it. And I was below the threshold of the high range number. Then I get into, now I have cancer unequivocally. And I talk about my doctor in the US, he had been my long established urologist, wanted to do a surgery right away. And I said, no. I actually went back to Europe for diagnostic procedures that were not available 6 and 7 years ago here in the US. And I described them. Most interesting, they're now available here in the US. So when I tell people I've gone to Europe, you don't have to, they're here now. So I describe how I chose surgery over the other methods, despite all the scare factors. I came out of it just fine, no serious side effects. I then discuss how I'm looking at the numbers and my cancer still remains. Tried salvage RT, that didn't work. Now what am I going to do? The US protocol is chemotherapy and these drugs that will just destroy your testosterone levels and all that comes with that. So I went back to Europe for imaging that was not available here. That was 4 years ago. Some of that's available now, but the key one still is not. And then I went to a surgery in, of all places, Belgium, because I couldn't find a surgeon in the US that would do that surgery. And that was a home run for me.
Okay. Now you mentioned testosterone. As a male, I actually, in my 40s, found out I had low T. So like a lot of guys do, I was diagnosed with TRT therapy, where I get shots every week to keep my levels at normal, rates for a male. What are your thoughts on TRT therapy?
My thoughts are, as with prostate cancer, we face a lot of misinformation. There is a lot of fear mongering out there to not do testosterone treatments as you age up because it can trigger prostate cancer, accelerate it. But when you drill down on this, MJ, you can't find any hard proof that it is a threat. In fact, you can find some studies that are saying actually no, it's not a threat. So we're confused. So this is where each of us have to be our own advocates. Think very carefully. I also had my testosterone brought down by the drugs, and it's not a fun place to be. It changes your whole outlook on life and your lifestyle and your body. And as you're in your 50s and 60s, it accelerates aging. There's no question about that. So we want to be careful. I would just say before you do something like that, be really sure you're not looking at prostate cancer.
Okay. That makes sense. So if our viewers are watching now, they can find your book at sheeporwolfcancer.com. I'm going to put the link down below. Also, your Facebook page. And if anyone is recently diagnosed, would you be open to having them, friend you on Facebook? Or are you?
Absolutely. This is what I do. This is my main emphasis right now is to talk to men, to give you my story so that you can compare it to where you are and make some decisions. The fact that I had to go through 3 treatments, two surgeries and radiation, and get on a heavy drug makes no sense to me. If I had done what I know today 15 years ago, my outcome would be better.
Okay, great. Well, if you're watching this, go through Murray's links below, sheeporwolfcancer.com. I've got his Facebook link down there as well. Murray, thank you so much for being here today. You are officially released from the Wolfe Den.
Thank you very much, MJ. It's been a pleasure.
Take care.